Hello, my name is Gary and welcome to my therapy room. And Heather has very kindly offered to model for us today, so thank you, Heather. What I'd like to talk about first of all are some of the things that every massage therapist should start off with, and not all of them do. So the first thing that is really important with your client is to look at them. And I've been for lots and lots of massages, and quite often they say, yeah, just pop on the table, and away they go, 10 times here, 10 times here, and how was that? And actually it wasn't very good. When you're looking at a personalised massage that is geared to that person to help them heal, you really need to look at that person, find out what's wrong, and then develop a strategy. So the first thing is diagnosis, the second thing is strategy, and the third thing is plan. How long is the treatment going to last? The client doesn't want to think they're going to come here forever. They like to know roughly how many sessions that they're going to need to come for. So the first thing we're going to do is we're going to have a look at Heather, and we're going to have a look at her back. Okay, so the first thing we're going to do is we're going to have a look at Heather, and a good way to do that is to come to the top of the table and just have a good look down the spine and down to the feet. So as I look at Heather, it probably isn't very clear on the video, but as I look at Heather, there's a slight twist on the hip. So we're slightly higher on the right hand side than we are on the left hand side. It's something that I need to be aware of. We're always going to be asking Heather for feedback. So you need to know what's hurting your client, if it does hurt, if it doesn't hurt. So Heather, any pain in there? That's fine. Bit tender down there? Slightly. We've got some slight tenderness, and we can feel that, because we can feel that that area there is tighter than that area there. In fact, you can probably see that. That's quite soft over there, and over there you can see that's just a bit tighter. So we know that there's something going on in there. Not surprising, because we know that that muscle there was really tight as well. And that's probably going to go down and into the hip. Is that tender, Heather? Okay. So we know that Heather is very tender just over here. So when we're thinking about a strategy, we know we need to loosen up this side. We know that we're tight in there, so probably it's going to be tight down the leg. So we have a quick look at Heather's leg and see if the tight muscle in the back and in the hip is reflected further down as well. So as we move over here, we just ask for feedback. Is that tender in there, Heather? Yeah. Yep, so we know we're tender just in there, which is coming down from there. How about around the knee? Tender again there, so it's along the same line. And right, so we know that the tightness has come down. It's down through her leg into here, and we're going to go down to the toes. And we put a little bit of pressure just between the big toe and the second toe. Not too bad there. A little bit of pressure in between the small toe. How's that? Tender. Okay, so we have an owl. Do we have an owl? Yeah, remember we have an owl. And so we know that there's some tightness in between the little toe and the one next to it, which runs all the way down there through the ankle, and so we're going to be tight just around there as well. Tender there. Okay, now relax. And we know that the body comes up, it goes across, and it comes up into here. So if we have a quick look around here, we're probably going to find, how's that? Painful. Okay, so we know that it's painful in there as well. So what we've got is tight muscle between the shoulder going right the way down to the little toe. So we need to release that whole area to make sure that wherever it's caught up is not going to keep hanging on. What we want to avoid is just saying, oh, you're a bit tight in the back, so we're going to massage the back, make that all feel very nice, that's great, but we're not actually dealing with the cause of the problem.
we're just dealing with the effect. And what we want to do is get to the real root cause of the problem so that we can help Heather to heal and to take away those pains. But what will happen is where she's got those pain going from literally from her shoulder down to her toe, she's going to be compensating on the other side. So we know that that's going to be tight into places as well, because Heather's going to be walking slightly lopsided, which is why there was a very slight twist on the hip. A very slight twist on the hip, and that's obviously all linked up together. So, as I said, the most important part of coming from massage for the massage therapist to do is diagnosis. We don't diagnose things like disease, but we do need to diagnose what's going on with the client, where the muscles are tight, and what we are going to do. If we don't have a diagnosis, we can't have a strategy to help the client to heal, and we can't make a plan for how long that's going to take. So that's the first part, diagnosis.